Hi, my name is Sara Cisneros, and today I'm going to be talking about the Food Stamp Act of 1964 and 1977. This bill was sponsored by Lenore Sullivan. The formal title was the Public Law Number 88-525. The date that it was enacted was August 31st, 1964. It was revised as the Food and Agricultural Act of 1977. It was sponsored by Andrew Young Jr. The formal title was the Public Law Number 95-113. The date that it was enacted was September 29, 1977. The subsequent revision to the original legislation. Ms. Mabel McFiggins is the first person to stand in line to make a food stamp purchase in 1939. In 1961, President Kennedy signs his first executive order, which initiates the food stamp pilot program. In 1964, President Johnson makes the Food Stamp Act program permanent by signing the Food Stamp Act. In 1974, the Food Stamp Act program expands to all 50 states and territories. In 1977, President Carter signed the Food Stamp Act, establishing the national standards of the eligibility and eliminating the purchase requirement. In 1984, payments using the Electronic Benefit Transfer (EBT) begins with the first EBT transaction purchase in Reading, Pennsylvania. In 2004, EBT use is adopted nationwide. In 2008, the Food Stamp Act program is renamed the Supplemental Nutritional Assistance Program, also known as SNAP. Describe the problems the policy was designed to correct. In 1964 and in the early 60s, farmers were producing more food than the nation could consume or export, and there was a large group of people who were going to bed hungry. Health problems and poverty-stricken areas, in particular problems associated with low birth weight, anemia, and osteoporosis. In 1977, children dying of severe malnutrition after years of depression. Many needy people, particularly the elderly, did not always have the amount of cash on hand needed to make the required purchase for food stamps. The extent or scope of the problem. There was 14 million participants in the food stamp program on July 1974. Statistically, 15.4% of Texans are on food stamps as of 2016. There is 41,170,732 Americans using SNAP and 22,318,000 Americans households receiving SNAP. There are 319,826 SNAP cases in Harris County as of October 2017 and 729,190 participants. The problem occurs in poverty households, elderly that do not have enough income, or working households that do not earn enough money to pay for their food. There is no one location because this occurs everywhere in America. A policy solution is necessary to address the problem. The Food Stamp Act of 1964 and 1977 policy solution is necessary to address the problem and prevent malnutrition. Malnutrition is a common cause of childhood death. Unless managed correctly, mortality rate from severe malnutrition can be as high as 50%. The goals and objectives of the policy. The policies are attempting to accomplish the end of prevent hunger and improve the social conditions of citizens with low incomes and provide a foundation for the U.S. agriculture. In 1964, based on the Food Stamp Act of 1964, the manifest goals were to provide for improved levels of nutrition among low-income households through a cooperative federal and state program of food assistance to be operated through normal channels of trade. The Lenten goals based on the Food Stamp Act of 1964 are to strengthen the agricultural economy to achieve a fuller and more effective use of food abundance. In 1977, based on the Food Stamp Act of 1977, the manifest goals are to assure consumers of an abundance of food and fiber, reasonable prices, and other purposes. The Lenten goals based on the Food Stamp Act of 1977 are to provide price and income protection for farmers. The policy benefits or program services. The policy benefits are the recipients that have a better quality of life. Everybody deserves a good life, you know. The Food Stamp Act of 1977 allowed for people that could not afford to participate to be able to be a part of the program. Eligibility rules for receiving benefits and program services. In 1964, the State Plan of Operation requirements and development of eligibility standards by the states. The requirement that the recipient purchase their food stamps paying an amount of commensurate with their normal expenditure of foods and receiving an amount of food stamps representing an opportunity more nearly to obtain low-cost, nutritional adequate diet. The eligibility for purchase with food stamps for all items intended for human consumption except alcoholic beverages and imported foods. Prohibition against discrimination on the basis of race, religious creed, national origin, or political beliefs. In 1977, eliminated categorical eligibility, established statutory income eligibility guidelines at the poverty line, reduced the number of deductions used to calculate the net income, and established a standard deduction to take place of eliminated deduction, penalized households whose heads voluntarily quit jobs, restricted eligibility for students and aliens, eliminated the requirements that households must have cooking facilities. In addition to eliminate the purchase requirement, the Food Stamp Act of 1977 included several acts of prohibition. Using mail, telephone, or home visits for certification, requirement of outreach, bilingual personnel and materials, and nutritional education materials. Recipients' right to submit application the first day they attempt to do so. 30-day processing standard and inception of the concept of expedited service. Notice of recertification and retroactive benefit protections, and a requirement of the state to develop a disaster plan. To accomplish its goals, Congress adopted a new mechanism to distribute agriculture surplus to poor individuals, food stamps, stamps that people could exchange for food at a grocery store. The U.S. Department of Agriculture provided these stamps through the state welfare offices, and this in turn created a key linkage between the federal and state government on agricultural matters. The Food Stamp Act required that the federal government pay for these benefits, but the state agencies determined individual eligibility, distributed the stamps, and conducted audits, monitored vendors, food stamp inventories, the federal and state governments. However, they shared the administrative costs of the program. This is how they delivered the services delivered system. The policy financing. The Food Stamp Act of 1964 was financed between the federal government and the states, with shared responsibility for funding of costs of administration, and appropriation of the first year limited to $75 million, for the second year to $100 million, and the third year $200 million. The department estimated that the participants in the national FSP would eventually reach 4 million at a cost of $360 million annually. The aspects of this policy needing change to make programs and services more effective and efficient. The food stamp program is effective because it has helped many people. Without the Food Stamp Act, many people would have died and been malnourished. The food stamp has helped boost the American economy during the recession and when people are unemployed. The policy is very efficient because it delivers payments on time. Thank you for listening to my policy analysis video. And this is some of my works cited. Here are 6, and here are another 6. Thank you and have a good day.